Hey, I'm Rachel. I'll be your nurse today. I'm just going to be doing your head-to-toe assessment. Washing my hands. Just by looking at my patient, I can tell that she is generally well appearing. She's in no obvious distress. She's dressed appropriately, well, hygiene. Are you feeling anxious, depressed, having any thoughts of hurting yourself or anybody else? No. Okay. Her vital signs, she is 5'4", 130 pounds, so her BMI is 22.31. Her blood pressure is 117/79. Her heart rate is 70. Temp is 36.8, and her respirations are 16. So to start off with, I'm just going to look her over and assess her skin. Her skin is normal for her ethnicity. It's warm to touch. It's dry. She has no obvious lesions or abrasions, and she has good elasticity as well. So the first thing I'm going to do is just kind of assess your head and your face. So I'm just going to feel your head. There's no obvious lumps or masses. Hair is dispersed appropriately. Her face is symmetric. She doesn't have any abrasions or anything on that. So I'm going to ask you to clench your jaw and assess for any pain there. Is there any pain? Okay. I'm going to assess your temporal arteries or pulses. They are 2+ bilaterally. Can you raise your eyebrows for me? Puff your cheeks and smile. The movements are symmetric on her face. So now I'm just going to test your sensation. So I'm going to have you close your eyes, and I'm going to touch in 3 different places. You tell me if it feels soft or sharp. Okay? Okay, so now we're going to do your eye assessment. So to begin with, I'm just going to hold up the sound chart and just read the last line for me. E, F, G, A, B. Okay? So for the next thing, I'm just going to assess your peripheral vision. So I'm just going to hold my hands like this. You're going to look at my face and tell me which hand is wiggling. Okay? Okay? So now we are going to assess your cardinal field view. So you look at me and you follow my finger with just your eyes, but keep your head straight at me. Okay. And the patient's pupils are 3 centimeters bilaterally, and they respond appropriately. So now I'm just going to get this, and just going to shine a light in your eyes. Okay, the pupil constricts directly and consensually on that side, and same for this side. So now, I'm just going to touch your face. I'm going to pull your eyelids down, and I'm going to have you look up for me. So the conjunctiva is pink. There's no drainage. The sclera is white. And now I'm just going to check your red light reflex in your eye. I'm just going to have you look straight forward, and I'm just going to use this to look at you. Okay, so the red light reflex is noted. Also see the optic disc, the cornea, and the same for this side. So both of her eyes are symmetric. They respond equally to light. Okay, so next we're going to do your ear assessment. So to begin with, I'm just going to inspect your ears. They are symmetric. There is no physical damage, no drainage present. So now I'm just going to test your hearing. So we're going to do the whisper test first. So I'm going to stand behind you. I'm going to whisper a word to you, and you just whisper, or say what it is. Duck. Okay? So now we're going to do the Weber and Ryan test. So I'm just going to take my tuning fork. I'm going to hit it. I'm going to place it behind your ear first, in front of your ear, and then for the Ryan test on top of your head. You just tell me when you don't feel the vibration. Okay. And then for this one, just tell me when you feel the vibration bilaterally. Now I'm going to use this tool again just to shine a light in your ears and just assess your inner ear. Okay, the ear canal is clean. There's no wax. The tympanic membrane is pearly and white. No redness. Same for this side. The cone of light is about 5 o'clock on the right and 7 o'clock on the left. Like I said, they were clean, no redness, no drainage present. Okay, so the next thing we're going to assess is your nose and your sinuses. So right now I'm just going to assess for patency. I'm just going to ask you to close one nostril and breathe out through the other one. And now the other side. Any trouble breathing or anything? Okay. So both sides are patent. So now I'm going to get the otoscope again. Turn the light on. I'm just going to shine a light in your nose. Okay. There's no drainage. Turbinates are not swollen. There's no redness. Days out of minutes. I'm just going to let it out. Alright, now I'm just going to palpate your sinuses and you tell me if there's any pressure. This is your frontal, your maxillary, any tenderness. Okay. I'm just going to put my gloves on. Now I'm going to look at your mouth and your throat, okay? And I am going to use a tongue blade for this. Put my gloves on. Just going to get you to stick your tongue out while I stick this light in your mouth. Okay. Tongue is pink and moist. There's no lesions, no abnormalities. Teeth are free from decay and caries. Say ah, ah. Uvula is midline, tonsils are 2+, and no etch date is noted. So next we're just going to assess your neck. So first we're just going to look at the range of motion. Can you put your head down for me? Go back, side to side. She has full range of motion. There's no restrictions. So the next I'm just going to palpate your lymph nodes. So I'm sorry, my hands are cold. So you got your preauriculars in front of the ears, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, posterior cervical, and supraclavicular. And so there's no enlargement, anything like that. So the next thing I'm going to do is I'm going to check your thyroid. So I'm just going to put my hands on there. Swallow for me. There's no masses or lumps, and so no deformities noted. So next I'm just going to assess your shoulders and your upper extremities. So the first thing I'm going to do is I'm just going to inspect your shoulders and your clavicles. They are symmetric. There's no deformities noted. So I'm just going to have you hold your arms up. You have lymph nodes right here. I'm just going to palpate those. So axillary, central in the middle, lateral, pectoral, and then the subscapular lymph nodes. They are freely movable and there's no enlargement noted. I'm also now going to palpate your shoulders at the sternoclavicular and out into the arms. Is there any tenderness in any of that area? Okay. So now we're just going to assess the range of motion. I'm going to have you roll your shoulders up and down. Any tenderness or toughness doing that? Okay. So now I'm just going to put my hands on your shoulders and I'm going to ask you to push up against the resistance. Okay? Gonna inspect your elbows, any tenderness in those. Okay. So now I'm just going to have you, we're going to assess your range of motion on your elbows. So she has full range of motion. I'm going to palpate pulses, brachial and radial. And they are 2+ bilaterally. And then I'm just going to have you put your arms out straight. And I'm going to have you push against my hands. So strength is 5 out of 5, bilaterally. So now we're just going to assess your anterior chest. So there's no signs of distress. Her chest movements are symmetrical with breathing. Her AP lateral diameter is 1 to 2. So I'm just going to assess carotid pulses. And they are symmetric 2+ bilaterally. So now I'm just going to listen with the bell of my stethoscope for a breathing. Nothing abnormal is noted, so now I'm just going to listen to heart sounds. So I'm going to listen to the aortic, pulmonary, tricuspid, and mitral valve. So her rhythm is normal, her rate is about 70. I'm going to find the point of maximal impulse is at the 5th intercostal space mid-clavicular line. And then I'm just going to listen to your lung sounds. I'm going to listen in 6 different places, okay? Starting at the apex. Lung sounds are clear and no abnormal sounds noted. Okay, so now I'm going to assess the posterior chest. So the first thing I'm going to do is just palpate for tactile primitives. I don't feel anything, so I'm going to percuss your back in 6 different areas, okay? And now I'm just going to assess for egophony and bronchophony. So for the first thing, when you feel my stethoscope, I just want you to say 99. 99. 99. 99. 99. 99. Now when you feel it, I just want you to say E. 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 Now just breathe regular. I'm just going to listen for your lung sounds. Lung sounds are clear bilaterally with no abnormal sounds noted. So next we're going to do your abdominal exam, and just upon inspection, the patient's abdomen is flat with no scars or hernias noted. So the next thing we're going to do is I'm just going to listen to your bowel sounds in all 4 quadrants. Bowel sounds are active. I'm going to palpate. Percuss your abdomen in quadrants. And now I'm going to listen for the arteries that are in your abdomen. I'm going to listen aorta, renal, iliac, now I'm just gonna palpate your aorta. And then I'm just going to palpate the right palpation over all 4 quadrants, and you tell me if there's any tenderness. Okay. Now I'm also going to percuss your liver, which is on the right side, and the spleen, which is on the left. Okay. And then we are going to test for your appendix with the celiac sign. So I'm going to let you lift your knee, and you're going to just push against the resistance of my hand. Any pain or anything with that? Okay. So then the next one is the arbitrary sign. And that one, you're going to lift your right knee and then rotate it internally. Any pain with that? Okay. So those are both negative. And there were no abnormalities noted on this exam. So now I'm just going to percuss your bladder or palpate your bladder. It is empty. And now I'm going to get you set up on the side of the bed, and I'm just going to test for CVA tenderness. Any tenderness? No. Okay. Any tenderness? No. Okay. None noted. So now we're just going to assess your lower extremities. So upon inspection, there's no edema or deformities noted. So now I'm just going to palpate your lower extremities from your hips to your ankles, and you just let me know if there's any tenderness or pain. Okay? So no tenderness or pain noted. So now we're just going to assess range of motion. So I'm going to get you to stand up for me. And I'm going to have you lift your leg up and then turn it out. Okay? And then I'm going to have you bend your knees up and out. Okay? And then just test for range of motion on your ankle. Just kind of. Okay? So the patient has full range of motion, no deformities noted. So now you can sit back down, and I'm just going to assess your pulses, palpate them. So you got your femoral pulse, your popliteal behind the knee, dorsalis pedis, and posterior tibial. And they are all 2+ bilateral. So now I'm going to have you push against resistance with your feet. Okay? So 5 out of 5 strength. And now we're going to test for sensation again. I'm just going to touch you with something sharp and something soft in 3 different places. And then you just tell me which one it is. Soft, 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 hard, sharp, sharp, sharp. Okay? And then I'm just going to perform the joint remover, and I'm just going to flex your knee, and I'm going to push in and out. Any pain? Okay, so that means there is no ACL rupture on this exam. So now we're just going to do the neurological check of the assessment. So I'm just going to test your deep tendon reflexes first. So I'm going to test your bicep, tricep, brachioradial, patellar, and Achilles, and they are all noted bilaterally. So now I'm going to do the Babinski reflex. So I'm going to take this and run it across the bottom of your foot. The toes curl under, which is the proper response. So I'm going to ask you to close your eyes. We're going to test sensation again. I'm going to give you an object, and you tell me what it feels like. Okay? So now we're going to assess coordination of your upper extremities. So I want you to touch your nose, and then touch my finger. And then touch your nose and touch my finger. And do it with the other side. Okay? So now we're going to assess coordination of the lower extremity. So I want you to take your heel and rub it down your shin twice, and do that on both sides one time. Okay? So good coordination is noted. So now we're going to assess the range of motion of the spine. So I'm going to stand behind you. I'm going to get you to stand up and bend over. Touch your toes. Spine is straight. There's no abnormalities. Stand up. Bend to the side and to the side. So the patient has good range of motion. So I'm going to ask you to do, watch your gait now. So do heel to toe to the couch. Patient's gait is equal and normal. So I want you to hold out your arms for 10 seconds. And we're assessing for drift and strength. Patient has good strength. There's no drift noted. And now we are going to do the wrong bark test. So close your eyes and just stand there. So no drift noted. Okay. So now the head to toe assessment is done. I'm going to wash my hands. Is there anything else you need from me?
No.
Okay. Thank you.